Give it a sec. Right. Go right ahead.
All right, I'm going to share my screen now. All right. Can everybody see that?
No.
Yes.
Yes. I can.
All right, everybody see it? Okay, first of all, thank you. I know everybody is really, really busy out there. You have 120 things that you need to do, and you took time out of your busy schedule to come and listen to me tonight. So thank you. Again, my presentation is Faithful and Intentional Mental Health. This year, Hope in Christ is the focus of the Baptist Nurses Fellowship. And one of the things that we've been talking about is to be faithful and intentional in all the things that we are doing. And so that's the title, Faithful and Intentional Mental Health. And the scripture that goes along with this, this is Romans 12:12. Rejoice in your hope, be patient in tribulations, be constant in prayer. So that's our scripture for tonight. And everything we're going to be talking about today has to do with hope and belief in God and belief that God can handle anything. And you say, okay, Karen, you know, you've got this, I was an Army nurse for 20 years, spent the last 15, 16 years of my practice, of my 43 years of practice as an emergency room nurse. And if anybody worked with me in the emergency room, they knew that I hated psych patients. You know, when we had a psych, we had 2 psych rooms, and I would do anything to get out of taking care of those psych patients. So you say, Karen, so how did you get involved in mental health? What do you want to do about this? Well, I'm going to tell you my story. Well, first of all, I retired in June of 2019. 2020 was going to be the year, the best year, because I was going to be able to do one of my bucket lists. Plus, my youngest son was going to get married. So in February of 2020, my youngest son got married in Orlando, Florida. Our whole family was there. We spent we spent a week there, and we had a ball. Just loved it. So, you know, on that. And then in March, my first thing on my bucket list was to go to Africa on a mission trip. So I went to Kenya and on a mission trip there with Marilyn, and had a ball, came back, had a ball. We were doing great. And then the pandemic hit. Here we are, we come back on March 15th, day before they close all the airports in the United States. So the pandemic started. In April of that year, my oldest son, right here, Christopher, was killed. He was going to work at 7 o'clock in the morning in San Antonio, Texas. A gentleman exited the interstate there at 81 miles an hour on his cell phone, hit Christopher, T-boned him, and killed him instantly. You know, I'm a survivor of domestic violence. I thought that when I survived the domestic violence that I had, you know, in terms of the Lord, that I had basically could survive anything. But the loss of a child is very, 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 very hard, very, very hard. In June of that year, this picture up here, the first floor of my house flooded. I said, okay, all right. In September of that year, this is a picture of my mom and my dad. My dad developed a really bad MRSA infection in his left knee that he had, his right knee that he had a replacement in, and almost died. He was in the hospital from September to December. In the midst of all of this, I was caring for my mother, who was in end-stage Alzheimer. in September also, she was diagnosed with cancer. And my dad was still in the hospital. I was caring for my dad and I was caring for my mom. And one morning I woke up, I sat straight up in bed, and the Lord spoke to me and he said, you've got to get your father out of rehab and get him to your mother, because your mother's going to pass. So, I mean, it was like I knew the Lord was speaking to me. So I got up that Thursday morning. I went to the rehab facility that my father was in. It was in the middle of the pandemic. I had to convince them to let him out. So they let him out and he came home. He was able to say goodbye to my mother. And then the next day left. The next day, my mother died. And after my mother died, then I dealing with my mother's death. And then my father stayed in the hospital until December, got my father out of the hospital in December. And then in January, I lost it. In terms of crisis, and just couldn't handle it. So I sought mental health, and it was mental health therapy that got me through. And I continue with my and God and the belief in God that got me through. And it is that sustains me right now. So I have been blessed with that opportunity for mental health. And that's a picture of my granddaughter from my younger son who got married. And so, again, it represents hope and that there's always new beginnings. So we're going to talk about mental health because I have a great appreciation for mental health and what it can do. And I really do think that we as nurses in the Baptist Nurses Fellowship and also as Christians need to be more involved in terms of mental health in our churches. So our objectives today, first, we're going to define mental health according to the American Psychiatry Association. We're going to list and practice ways to maintain mental health. We're going to identify the signs and symptoms of mental health disorders and their spiritual implications. And we're going to describe ways to enhance the current environment of the faith community to ensure a caring and supportive environment for those needing behavioral health support. So mental health, what is it? You guys come on and participate. You can turn your moots off. When we talk about mental health, what is that? What is that? I mean, you can see the screen there, but what's your definition of mental health? What do you think? Anybody?
Balance.
Balance, okay. Yes, balance in terms of life.
Healthy relation to other people.
Healthy relationships to other people, exactly. Anything else?
Adaptability to situations.
Exactly, adaptability to situations. All that's involved in terms of mental health. You're able to go to work, hold a job, provide for yourself, support your family, and adapt and deal with adversities. And adversities do come with life, all right? And then in this day and age, all of us women deal with something else in terms of this superwoman syndrome. We've got to do everything to the nth degree, in terms of work and house and church and any other activities that you're involved in. And, in terms of your kids, your room mothers or whatever, we could do it. We need to do it all. We think that we need to do it all. And we're constantly running. And what happens? What happens?
We crash.
You get stressed.
You crash, you get stressed. That's exactly right. It's just stress. Exactly.
Burnout. You get
Burnout.
burnout.
That's exactly right. And so we deal with this superwoman syndrome, because everybody thinks that you can do it all. And we end up getting stressed and burned out. And so one of the things and one of the ways that we can prevent that from happening, we talk about resilience. And resilience is basically the way to adapt to difficult situations and challenging life situations, And those are things that we're going to all experiences, right? We talk, and now when you talk about mental health, there's a lot of talk about resilience and what you're doing in order to be able to deal with all that's going on in this world. And there's a lot that's going on in this world right now. So there's the 3 C's of resilience that Susan Kobasa talks about in terms of resilience. One is first thing she talks about is challenge. And that basically that means what she's talking about when you challenge is how you look at things. She talks about having a positive attitude. You don't look at difficulties as difficulties, you look at it as changing. And they're not something that's going to paralyze you and prevent you from doing things. If you fail, basically, you know, it's a learning opportunity. You know, I failed. Okay, what do I have to do to make this work the next time around? And that you don't think about it as a negative, as something in terms of you as less self-worth on you. Just that it just happened. I'm going to learn from it and I'm going to move on. She also talks about commitment. The fact that when one of your, in terms of resilience, the fact that you're committed. You're committed to your life, to your goal, to your religion, to your family, all those kinds of things, and that you don't get up, you don't give up. And then personal control. You know, you're going to focus your time and your energy on situations and events that are important to you and that you can have control over. This is something that's really, really hard for me in terms of personal control. You know, you learn that you do your very best to help someone, to help yourself. And then when you can't do that anymore, then you pray for them. You give it to God, and you give it to God and let God have it, and you don't take it back. So you do what you can, you pray about it, and then you don't worry about it. So also, the best way that we can achieve resilience is through self-care. And in all these areas, we need to build resilience in terms of self-care. First thing we talk about is physical self-care. You know, getting enough sleep. How many people get 7 to 8 hours of sleep a night? Not a whole lot. No, it's really hard. It's really hard to do that. How many people are involved in regular physical activities? Are eating a well-balanced meal and watching your caffeine intake, that kind of thing. Those are what you have to do. And I know these were all things that are hard for me. And so one of the things I've helped in terms of physical self-care is I've developed a buddy system. One of my neighbors, you know, we get out and walk 3 times a week to make sure that we're doing that. In terms of regular well-balanced meal, I've actually joined a co-op with a farm here. And once a week I go out to the farm and actually get the food that I'm going to eat and help in terms of my diet, that kind of thing. Emotional self-care, know your vulnerabilities. Know when you're getting overwhelmed, so that you're not presuming that you're not increasing your anxiety about something. Try to be proactive about things. Relaxing. What kinds of things do you relax to do? You know, one of the things that I hate most is house cleaning. And I like a clean, organized house, but I hate to do it. But one of the things that I find that helps me now is I put on gospel music to clean the house by, and I'm relaxed and I'm grateful as I'm cleaning my house, and that helps me in terms of that. So that music is soothing to me. And then social self-care. Be aware of withdrawal and isolations. What happens when you withdraw and isolate yourself? What happens?
We get depressed.
You get depressed. Yes, the devil sneaks in there and you start thinking, I'm not worthy. I don't amount to anything. People don't want to be around me. This week, August 29th, was Christopher's birthday. He would have been 46 years old. And there was a funeral at our church, someone that I knew. And also we had our business meeting for the church that evening. And I had said I was going to go to both of those things. I had to present at the business meeting. Well, I got up in the morning and I was like, no, I can't go to this funeral. And then for the business meeting I emailed my pastor and said, I'll join on Zoom and I'll do my presentation on Zoom. I didn't want to be around anybody, but by the end of the day, I realized what I was doing. I was isolating myself, and that would have just put me back into a depression that I suffer from. And so the next morning I had to get up and go and be around people so that I knew that I had to get out and be around and have other people nourish me and help me and support me. And so that's what you want to do in terms of friends, family, and community for support. And then spiritual self-care in terms of religion, resources, your personal time with the Lord every day, reading your Bible, praying, all those kinds of things in terms of spiritual self-care. Mental, process your thoughts. Set some time around for you to just think and think through things. Have quiet times. Try something new. Engage your mind in something new you're doing. And don't watch 24/7 TV and news. That'll just depress you. And then in terms of environmental self-care, declutter your space, home, office, and car. That helps in terms of being resilient because you know where everything is. Everything is order. God is the God of order, and so that helps in terms of decreasing anxiety. Spend some time outdoor and that kind of thing in terms of environmental self-care. One of the other really important things in terms of resilience right now is practicing gratitude. And you see a lot about in terms of gratitude. Dr. Sexton here, I had the opportunity to hear him speak at the hospital that I worked at. And he talks about 3 good things. And he says what you do in terms of his study is at night before you go to bed, you think about 3 good things that happened during that day and your involvement in that and how that made you feel. And what he was able to prove through his research that when people did this, and it was for 14 consecutive days, they did this, that what happened is they woke up with a positive feeling in the morning. People actually improved their health in terms of decreasing their blood pressure, increasing their energy level, all those kinds of things by focusing on practicing gratitude. And then right now we talk about relax. So we're going to just do a little relaxation exercise right now. And all of you have been running all day long, rushing to get dinner done, rushing to come here. And before we move into talking about mental illness, I just want to put everybody at relax. So everybody's in their home, and hopefully you're in a place that you feel safe. And I want you to close your eyes. Close your eyes. And then I want you to take a deep breath in through your nose and then out through your mouth. And then I want you to pull your toes up and hold your toes. Pull your toes up and hold up. Then relax. Stretch your right leg out. Just stretch it out. Feel that stretch. Hold, and relax. Now stretch your left leg out. Hold. Relax. Squeeze your thighs together. Now hold and relax. Tighten your buttocks. Hold, relax. Tighten those abdominal muscles. Hold them, and relax. Arch your lower back. Just arch it. Stretch that back, arch it, hold, and relax. Press your lower back down, downward, down, press down. Hold and relax. Breathe in deeply Hold, hold, and breathe out through your mouth. Make a fist with your right hand. Hold, relax. Make a fist with your left hand. Hold, relax. Raise your left shoulder towards your ear. Hold, relax. Rest your right shoulder towards your ear. Hold, relax. Bend your neck forward slightly.
Turn off.
Hold, relax. Purse your lips together. Hold, relax. Clench your teeth together. Hold, relax. Open your eyes wide. Hold, relax. Close your eyes tightly. Hold, relax. Wrinkle your forehead and frown. Hold and relax. Lift your eyebrows toward your hairline. Hold, relax. Take a deep breath in through your nose. Hold, relax. Take a deep breath in through your nose again. Hold, relax. Take another deep breath in through your nose. Hold, and then relax. Now, how do you feel? Feel pretty good? All right. So we've just done something that helps with resilience that you can do on your own. Thank you. So now we're going to talk about mental illness. So we talked about what mental health meant. So in terms of mental illnesses are diagnosable health conditions involving changes in emotions, thinking, feeling, or behavior. And they're associated with distress or problems functioning in society, work, or family activities. And there's a whole lot of various diagnosable mental illnesses and mental disorders. And like it says there, we'll talk about mental illness and mental disorders interchangeably in terms of this presentation. So just some statistics. 1 out of 5 adults live with mental illnesses. About 1 in 25 adults live with serious mental illnesses. And 50% of chronic mental illnesses start before 14 years of age. Can you believe that? Before 14 years of old. And 75% of chronic mental illness starts by age 23. And just over 10 million people over the age of 18 have more than one addiction or mental health disorders. For individuals from 15 to 34 years of age, suicide ranks as the second leading cause of death in the United States. And also, recently, there was a survey by Kaiser Health Foundation and CNN, and they said that 90% of adults said the United States is experiencing a mental health crisis, just in terms of mental health. Some other statistics, people are having to wait a whole long time for waiting period before they can even get any kind of mental health care. And that's why I think it's important that the church get involved so that we can be there and support people until they can actually see a mental health provider. And then 25% of people have been faced with making decisions between daily necessities and paying for mental health care. It's expensive. And I know when I was going, it was $150 a session. It's very, very expensive. And like I said, some people are giving up other things. So again, there's a place that the church can be involved. And then people having to travel long distances for mental health. And then because of all of these things, people are trying to tough it up. They say that I just can't drive, I can't afford it. I'm just going to have to tough it out. And one of the things that we know about mental illness is the earlier that there's an intervention, the better the outcome. And so we don't want people putting off the time. And the cost. And each year, serious mental illness costs Americans $193 billion in lost earnings. That's how much it's cost. So it's very, very expensive in many ways. And so what does the Bible say about mental illness? Well, there's not a whole lot when I started researching in terms of the Bible. The only thing I could find was in Deuteronomy 20:20, where it talks about the Lord will strike you with madness and blindness and confusion of heart. And you're like, oh. And then, you think about mental illness. When I thought about people in the Bible, and I thought about Jonah, because I often compare myself to Jonah. The Lord was after me for a long time before I actually committed to him. And here you have Jonah, and then, who was in the belly of a fish for 3 days because he disobeyed God. And by the time he was sped out and he went on to do what he had to do, he was depressed. He was actually depressed. And then Naomi, we think about Naomi in terms of mental illness. It says that life and depression had so impacted Naomi that the townspeople did not even recognize her. So that's pretty much, when you go and when I started looking through the Bible in terms of what the Bible says about mental illness. But then what does your church say? Well, in Amy Simpson's books, Troubled Mind, she looked at some surveys in terms of what the church says. That 12.5% of church leaders say mental illness is discussed openly and in a healthy way in their church. 12.5% only. 77% of church leaders are approached more than 2 times a year to help with mental illness. And then 37.9% of church leaders have never reached out to someone in their congregation with illness despite being aware of it. And then 30% of survey respondents say mental illness is a reflection of a spiritual problem that must be treated spiritually. What do you think about that? Not a lot of support to people that are going through mental disorders and illnesses.
But Carrie, do you think that that's partly because, I'll just say myself included. I mean, like you didn't taking care of somebody in the psych ward wasn't your forte. And so you kind of shied away from it. And I know for myself, it's like sometimes I just don't know what to say. I'm scared to say the wrong thing. But I think that's part of. I think part of it is kind of a taboo to even talk about, which it shouldn't be, because it's just like your physical illness. And then I think that people just they shy away. They don't even talk about it in the church at all.
Exactly, and we're going to talk about that later in their presentation. And you, just like I said, there's this fear and misunderstanding of mental health. I don't want to say the wrong thing. I don't know what to say. But we have to get through that, because so many people are affected by mental disorders right now. The pandemic only increased that, and we've got to stop shaming people and thinking that mental health people are violent people and that we can't talk to them and that we don't understand them. Those are things that we have to work on in the church, because we are losing people out of the church because we are not dealing with this. And if we're supposed to be compassionate Christians, How can we say that we're Christians and we love our brothers and sisters if we're not willing to deal with the mental illness or the mental disorder that they have? And this is a Lifeway research study in 2014. 18% of individuals with mental disorders have broken ties with the church due to the response of the church. You know, Matthew 28:18-20 is, you know, we talk about the Great Commission. We're supposed to be going out to there and bringing people to Christ. But instead, we're pushing people away from the church because we don't know how to deal with their mental disorder and we don't know how to be compassionate or to talk to them. So in her book, Lisa Murray, Peace for a Lifetime, she talks about 4 truths people with mental disorders need the church to know. Mental disorders is not a character or spiritual disorder. You know, a lot of what happens to people are because of chemical imbalances in the brain or because of trauma. And people with mental disorders don't just need prayer. Yes, we need to pray for them, but we know they also need intervention and they need support. Mental illness does not reveal a lack of faith in God. And people with mental disorders do not need to get fixed before they can be used by God. One of the scriptures that I really love from the Bible is 2 Corinthians 1:3-4, where it says, "Blessed be the God and Father of our Lord Jesus Christ, the Father of mercies and God of all comfort, who comforts us in all our tribulations, that we may be able to comfort those who are in trouble with the comfort with which we ourselves are comforted by God." So all of us have been through trials and tribulations in our lives. Most of us have had some depression in our lives. You know, how did we get through it? What this verse is telling us is that we need to use the skills that we have, that we used when we developed obstacles in our life, and we had people and God to comfort us, to go and to comfort other folks. We have to teach them, you know, the tools to survive and to deal. And then let's talk a little bit about trauma. You know, trauma, it says, defined as an experience that causes a person to feel terror, powerless, and overwhelmed, and that challenges their capacity to cope. It leaves an imprint on the person's nervous system, emotions, body, learning, and response and relationships. And then again, 1 in 3 diagnosed mental health disorders in adulthood are known to directly relate to adverse childhood experiences, childhood trauma. You know, trauma affects the body. Trauma causes all kinds of undue things to happen in the body and to lead, as it says here, to neuropsychiatric problems such as post-traumatic stress disorders, conduct disorders, dissociative disorders, all kinds of disorders. You know, let's talk about the brain and trauma. I don't know if you're familiar with the hand, using the hand to teach kids about the brain. But when you open your hand like this, you know, this part of is the brain stem. This part, if you take your hand, when we teach the kids about the brain, when you put your finger across here, your first knuckle here is the hippocampus, and then this part here is the amygdala. And then when you cross your hands over here, the first part of your knuckles there are the prefrontal cortex. And this is how we teach about the kids about the brain. And we say to them, you know, this part right here is the brain stem. It's basically, you know, controls your automatic systems, you know, to make sure you're breathing and all that kind of stuff. And then your hippocampus is involved in terms of your memory and safety. It also helps to calm the amygdala, and then, calm the amygdala, the hippocampus. And then your amygdala is actually your fear system, to help you signal when there's stressful events or to protect you from drama, so from danger. That's what gets your heart rate going up, gives you the energy to run, basically to fight, flight, fight, or freeze in terms of the amygdala. And then your prefrontal cortex right here, that's your thinking brain, that helps to control your behavior, helps you to make rational decisions. And we tell the kids that when they get angry, when they get scared, when they lose it, what they do is they flip their lid. When they flip their lid, the prefrontal cortex right here isn't helping to control their actions and their emotions, and they do things that they regret later. So what happens in terms of the trauma to the brain, the amygdala, if you're constantly being traumatized, then the amygdala becomes overactive. And so what happens is it's saying danger, 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 just like that outer space computer, danger, danger, danger all the time. And it can lead to a feeling of anxiety and being in danger all the time because it's reacting. And then the hippocampus, because you don't have the prefrontal cortex there to control things, the way that you remember things is not actually as it happens. And we've seen this in people that have been traumatized because of domestic violence, and also kids that are re-traumatized. They get to the point that they can't even remember exactly specific things that happened during that period of time. And then again, because the prefrontal cortex is up here and it's not working, and it's a muscle, it's just like a muscle, when you're not used to it, it shrinks. And so, when we find folks that have had trauma after trauma after trauma, and we wonder why they aren't acting right, it's because that prefrontal cortex has actually shrunk and decreased their reasoning ability. And then the Faith Trust Institute, they have what they call a trauma tree. And this part of the tree right here is the part of the tree that's experiencing trauma. And you have a family history of trauma, you have hopelessness, anxiety, rape, discrimination, racism, disaster, fleeing home country, neglect, terrorism, loss, war, all these things, these trauma causes what causes, and it's been found through research, is you get physical disability, physical symptoms, chest pain, diabetes, stress. You have that flashbacks. They have that flashbacks because the hippocampus is not functioning right, and all of a sudden these flashbacks of whatever happened to you keep coming. You have depression, anger, racing heart, headaches, all those kind of things that contribute to that. We're over here. One of the things that we want to emphasize is that trauma, mental illness, mental disorders can be helped. There is hope beyond hurt and hope beyond mental illness. Because when we provide social connections, knowledge, therapy, healthy lifestyle, primary care, and supportive care, then we have recovery, we have health, we have wellness, we have fulfillment, and we have hope. So that's what we as Christians, Baptist Nurses Fellowship nurses, what we want to try to do is make sure that we're helping in terms of there is hope beyond hurt, that we're providing healing and hope and hopefulness. So I think we've got time for this. This is a quick video. I didn't have time to go through and explain all kind of common mental health disorders. So we're gonna see this quick little video here. If it'll work. Oh, wow. Can you guys see it?
Before we begin, we'd like to add a quick warning discretion. This video discusses mental illness, including eating disorders and PTSD. What is mental illness? According to National Alliance on Mental Illness, It's defined as a condition that affects a person's thinking, feeling, or mood for a sustained period of time that negatively impacts them. You might be wondering, is depression a mental illness? What about anxiety? Yes, they are. In fact, they're the most common types of mental illnesses. In this video, Psych2Go covers 10 of the most common types of mental illnesses. 1. Anxiety disorders. We know 18.1% doesn't sound like a lot, but that's the number of adults in the US who suffer from anxiety disorders. 40 million people suffer from symptoms of an anxiety disorder every year. Of those 40 million people, it's estimated that only 36.9% of them will get help. Anxiety disorders rarely appear alone, with depression being a common co-diagnosis. Anxiety disorders come in a few varieties: generalized anxiety disorder, GAD, panic disorder, social anxiety disorder, SAD, and obsessive compulsive disorder, OCD. So, what do all these anxiety disorders have in common? They're all characterized by nearly uncontrollable worry that messes with several aspects of daily life, such as sleep, relationships, school, and work. The good news is there are several treatment options available, which include different types of therapy and medication. 2. Personality disorders. What does it mean when someone's personality is disordered? Personality disorders refer to behavioral, emotional, and thought patterns that deviate greatly from the expectations of an individual's culture. The National Institute of Mental Health suggests that 9.1% of the population has the traits of a personality disorder. So what does this look like in real life? Could anyone who's a little different be diagnosed with a personality disorder? Well, according to the diagnostic criteria in the DSM-V, these differences must be causing the individual significant amounts of distress in the way they see themselves, others, and situations, inappropriate or exaggerated emotional responses, impulse control, and how well the individual relates to and functions around others. Personality disorders can't be cured, but thankfully they can be treated. This treatment consists of combinations of medications for the underlying mental health issues, as well as talk therapy. 3. Attention deficit hyperactivity disorder. If we say ADHD, what comes to mind? The stereotype of a person diagnosed with ADHD is usually a small child who's bouncing off the walls or can't finish a task. However, between 7.8 and 11% of children aged 4 to 17 are diagnosed with ADHD any given year. ADHD affects people of all ages and includes multiple symptoms, such as inability to concentrate, forgetfulness, inability to sit still, restlessness, and losing things. An individual's symptoms vary depending on their age, gender, and type of ADHD. Did you know there's actually 3 recognized types of ADHD? They're ADHD, combined type ADHD, impulsive hyperactive type, and ADHD inattentive and distractible type. Most people think meds are the only way to control ADHD, but many people diagnosed with the disorder find relief by using a combination of medications, life coaching, education, and talk therapy. 4. Post-traumatic stress disorder. Did you know that an estimated 6.8% of the US population will develop some form of post-traumatic stress disorder? That's about 19 million people in the US alone. So how does this happen? You, me, everybody will get stressed out by something in our lives. Some people will come across something so stressful that it affects them permanently. For many of them, this stress becomes trauma. A traumatic event is considered any event that should not have happened, such as a natural disaster, an assault, childhood neglect, abuse, starvation, and so on. Stress is a completely normal reaction to trauma, but what happens when the threat is gone? The stress and trauma stops on its own for most people when the mind and body understand the individual is no longer under attack. But what if the mind and body don't get the memo? Post-traumatic stress disorder refers to a prolonged fight or flight response that happens after the stressful event has stopped. Complex post-traumatic stress disorder, CPTSD, refers to the PTSD that occurs due to a series of continued traumatic events, such as childhood abuse. Think of PTSD and CPTSD as the echoes of the stress response. These echoes can happen in the form of emotional flashbacks, nightmares, extreme anxiety or panic, difficulties connecting to others, and an overwhelming sense of fear. So how does someone get help for something so overwhelming? People suffering from PTSD or CPTSD can find relief through trauma therapies, such as eye movement desensitization reprocessing, EMDR, or traditional talk therapies, such as cognitive behavioral therapy, CBT, or dialectical behavior therapy, DBT. 5. Depression. An estimated 6.7% of the US population over the age of 18, 15.7 million people live with depression. Although the occasional low mood is a normal response to negative situations, depression entails low moods that are severe and last longer than 6 weeks. Depression manifests differently in women than men. Women tend to experience depression as feelings of sadness, worthlessness, and shame or guilt. Men tend to mistake the symptoms of depression as fatigue and being easily irritated. Common treatments for depression include cognitive behavioral therapy, CBT, interpersonal therapy, IPT, psychodynamic therapy, psychoeducation groups, antidepressants, and various brain stimulation therapies. 6.
I'm going to stop that now so that we can finish the presentation. But this is actually a YouTube video that talks about the 10 most common mental health disorders. Okay. All right. Oh no, so let me see how I get back to my presentation. All right, so that's 10 common mental health crash course. It's actually 14 minutes long if you want to follow that. But what we need to talk about is what the church needs to do. And the first thing we need to do is talk about educating the congregation. Like someone brought up earlier, what do you say? How do you talk to somebody that has a mental health disorder? Well, one of the things that I found very helpful and the Baptist Nurses Fellowship provided me with was to attend the mental health first aid instructors course in terms of mental health. And what the mental health first aid does is teach you in terms of how to interact, how to approach, and how to support someone with a mental health disorder. Just as we have CPR for physical, if somebody stops breathing, mental health first aid is basically the CPR for mental health disorders. And they use an acronym called ALGE in terms of the way that they provide training. First thing you're going to do is assist for risk of suicide or harm, listen non-judgmentally, give reassurance and information, encourage appropriate physical help, and encourage self-help and other support strategies for the person while they're waiting or while they're continuing with whatever therapy they're involved with. And just like I said, in terms of mental health disorders, the most important thing is early intervention. So the sooner you can connect a person to professional help, the better the outcomes. And then also, in terms of early intervention, prevents the complications that people with mental health disorders end up having when that disorder goes on for a long period of time and they have no intervention. They lose their job, their friendships, their relationships, they drop out of school, and sometimes they end up with problems with the law and drug and alcohol. So what the church needs to do is first keep the church a safe place, become a trauma-informed church. When we talk about trauma-informed, it means that people are educated about all the different complications that can come from trauma, and being careful not to re-traumatize interventions. There talks about the 4 R's of trauma-informed care. It talks about realization that somebody has experienced trauma, recognizing within the organization what you can do and how you can support someone with trauma. The 3rd R is response. And then again, the last R is preventing re-traumatization. So, in terms of in terms of someone, you go to church and you sit and you see people, you see the people that come in, and you notice someone that sits by themselves, is not interacting, not talking to people. One of the things that you could do is just go befriend that person. You could just look at that person's face and befriend them. And a lot of times people, all they want is somebody to recognize that they need help. So you could go up to them and say, hey, I'm so-and-so. I've been seeing you in church, and it appears to me that you might be going through something. Would you like to talk to me about it? Would you like to talk about it? You could take them into another room. You can offer to take them to coffee, that kind of thing. You have struggling single parents, maybe even regular parents in your church, maybe parents that have kids that have different types of disorders. They are really stressed. They're really having a hard time. Can a group of people get together and take care of their kids? Those kinds of things. Churches can also offer counseling. NAMI, the National Alliance of Mental Health, and there's a NAMI in most cities, or you can look online and find one that's close to you. They have counselors. They have people that are willing to come and have counseling sessions at your church, or even support groups that can meet for support groups, so people can sit and get support from them. And the other thing is to talk about mental health. Get your pastor talking about mental health. Have educational offerings about mental health. I really do recommend, in terms of the mental health first aid course, that you offer that in your church, so that people can talk about mental health. You learn to train. The one great thing about the mental health first aid is that it provides situations. It puts you in situations, and you have to react in that situation, and it teaches you how to react. So you do a lot of role playing in terms of how you talk, what you need to look for, and those kinds of things. And we don't have time for this quiz, but I just want to also talk about that. September is Suicide Prevention Month, and connection is prevention. We talked about connection is talking to people, connecting with people, observing people, asking people how they're feeling. Is there anything that I can do to help you? September Suicide Prevention Month, they said ask. One of the hardest things that you can do if somebody's going through a really, really hard time is ask the question, are you thinking about, and you have to use the word killing yourself, not harming. Ask them, are you thinking about killing yourself? And then, then you need to keep them safe. Listen to them. People want you to listen to them, and don't deny people's feelings. If someone's saying how they're feeling, you can't say you can't feel like that. That's the worst thing you can do. Listen, acknowledge their feelings, help them to connect. The 8988, you could dial 988, the suicide crisis line, just 988, and they will put you into a suicide crisis line that's connected for you. And then stay connected with that person. Once you're connected with them, keep going back and checking on them and making sure that they're all right. So finally, Matthew 11:29 says, take my yoke upon you and learn from me, for I am gentle and humble in heart, and you will find rest for your soul. The Lord is asking us to also take the yoke up to help our fellow Christians, our fellow man. And showing love is how we share hope in Christ. Any questions?
Karen, that was a beautiful presentation. And before we hear a first question, we could not see the video. So if you could put the link in the chat, they can go back and see that later. Yeah, we could hear it. We could hear it, but we couldn't see it.
You couldn't see it? Oh, I'm sorry. Okay. All right. And so any questions?
If you'll pull up the slide, I'll put it in while you answer
Right
questions.
there.
I got it.
Mm-hmm.
I'll put it in. if it'll let me copy it. Oh, I see. Maybe you need to put it in. It's not letting me it's not letting me copy it.
I don't think it's gonna let me, wait a minute. Let me copy it, get the link up here. Oh, I don't know if I can get the whole link. Maybe. Let's see. Get rid of this now. Get back to my Zoom.
Don't, if Karen, if you can't get it, we'll get it later and I can send it out. So just
Okay.
see if anybody's got questions or comments.
Anybody have questions or comments?
I don't know if you're looking in the chat, but everybody's saying thank you, a great presentation, so wonderful, you know so much, but yet you were able to present it in a down-to-earth way. I could listen to you all the time. Blessed us. Excellent presentation. Thank you, Karen. So good and certainly very relevant. So you can see all those. Very good, excellent presentation. Great hour. I think we've all learned a lot, and we certainly know that this is a very timely thing that we see everywhere we turn. People suffering with mental health issues.
I challenge you to look around your church this Sunday and see if you see someone that maybe is looking down a lot, looks, like they're hurting. And just go up and introduce yourself to them and ask them how they're doing. That's all you have to do, how you doing.
How do you get that mental health presentation that you were talking about for your church?
You can contact me. The Baptist Nurses Fellowship has sent me to be an instructor, so I can come to your church and teach it. Yeah,
Can you put that slide back that was there that had your information on it?
Well, you can contact Marilyn. Just contact Marilyn.
Okay.
And we can set that up. Yes.
Yes, we certainly can. I'd be happy to do that. And I'm putting up the slide again. After this presentation, we'll be contacting Mrs. Watson, and she will send you an email, if not tomorrow, the first of next week, that will give you a link that will take you to the evaluation, and that will automatically generate a certificate for you. And if you have any questions, you can contact her or you can contact me. And it looks like Susan Martin was smart enough to put your link into the chat.
Oh, okay.
So she is a whiz at IT. So thank you, Susan, for doing that.
Yeah, it's about 14 minutes long, but it goes through all the different types of mental health disorders. And I like it because those are the mental health disorders that we talk about in mental health first aid. And we use, like I said, it's role play. And so and they teach you to observe and watch. And they teach you the different interventions that you could use in terms of support for the different mental health illnesses.
Karen?
Yes.
Last Sunday, our women's ministry, we had a luncheon, and we had a lady who is a counselor here in Columbia, and she did a whole hour's worth on anxiety.
Yes.
And she used scripture and just it was very good. And then also back in May, our WMU, South Carolina WMU, they had the mental health course. It was a full day's course.
Yes.
And it was excellent. We talked about algae and role playing.
Yeah.
And they're probably going to do another one. So just look out for that.
Yeah.
Anybody in SC.
Karen?
Yes.
This is Paula Tutherode in North Carolina. I have a friend who needs a counselor. her primary physician also knows that she needs a counselor. She is on Medicaid and limited funds, and there are not counselors in this area at this time. How can we network to help her?
One of the good things, that came out of the pandemic is the fact that there's so many counselors that are online right now that you can do counseling through Zoom. In fact, that's, I don't go to my counselor's office anymore. We talk over Zoom, that kind of thing. So I would do a search for counselors that accept Medicaid. That person might be in a different state, but if you could get your friend to a computer, they can sit and talk. And I find it just as effective. And in fact, I like it better than going to somebody's office, because I can do it from my home and sit and talk and that kind of thing. Yeah.
Mhm.
So I would suggest that. And also NAMI, if you look for NAMI, the NAMI association for your area, and they also are usually a wealth of knowledge about counselors and how you can get support too.
Thank you.
Mhm. Anyone else?
Don't forget to sign into the chat, because that's how we take the list of attendees. And be sure and look at our BNF page and sign up for the summit. We'd love to see everybody at the summit at First Baptist Church of Jackson, Mississippi, November 3 through 5. We're going to have a great program. We're going to end the weekend with a mission project at Soul City Church in downtown Jackson. And it's going to be a block party and a time to give health attention to people in that neighborhood. So we would love for you to be there. So I have 8:10, and if you want to stay on and continue talking to Karen, as long as she's willing to stay, we will stay on. But I know everybody's time is precious, so feel free. You have stayed for the whole thing, so you're going to get credit. So I'm going to stop recording now, and we will stay on as long as